Reed Smith, Chief Consumer Officer at Ardent Health. Thanks for
Yes.
sitting down with us
Yeah,
today.
happy to do it.
So this class is for kind of the wide campus. It focuses on entrepreneurship and introductory management topics. Most of the folks are juniors and they're kind of just getting into the things they're going to do in upper division.
Yeah,
Um, so, their exposure is kind of, I think, kind of broad, but maybe a little not so deep in terms of what different industries and what those industries face. So
sure.
tell us a little bit about healthcare and your
Gosh,
role.
that's a big question. Yeah. So I have spent the better part of 20 plus years really on the provider side of healthcare. So hospitals, physician practices, state associations, things like that. So not so much in the pharma or biotech space, but really on the provider side. And I think I got a marketing degree because that was the closest art degree in the business school, I guess. But it's changed quite a bit. I think when I came into this space, and for the first probably 10, 12 years, it was pretty easily a predictable process of how people consumed healthcare. And I think that's the biggest thing that changed. People typically would go see their doctor, their primary care physician, and then they kind of quarterbacked them through the system. You should go do this. You need to now do that. Go see this guy. It was a very linear path as far as a journey was concerned. It's changed, and I think what people expect now is what they expect in the rest of their life. Convenience, all the friction to be removed. They do it on their own time in their own way. And so the ability to even schedule appointments online, that may sound really rudimentary, but in healthcare, that is still pretty new,
Mhm.
right? Um, Doctors, as you might imagine, are somewhat protective of their schedules. And so allowing them from a technology standpoint to turn loose of that schedule and allow somebody to book an appointment with them is still a newer concept, especially with specialists, right? And some of it for good reason. Hey, did they get their labs done? Did they already get the X-ray done? I don't need them coming to see me till they do these things. So there's some precursors, but I would say a lot of it's on the experience side. It's just really changed. Kiosk check-in, tell us you're on your way, paying your bill online, Apple and Google Pay inside the little patient portal on your phone. These are all things that people expect now, or even when they call into the contact center. I think my son told me one time if I actually have to talk to somebody, something's gone wrong. So I think that's the biggest difference, right? It's just the way people consume it.
And so, what were the impediments to that adaptation? So, we haven't seen such
Hmm.
difficulty in other sectors, healthcare being such a massive sector.
Yeah.
I mean, I guess in a perfect world, the bigger one would adapt faster, but that hasn't been maybe the case.
No, and I think you hate to play the we're different card, but it from a payer perspective, it's a little different in the sense that one, you're selling something no one wants.
Yep.
Nobody wants to buy anything that I have outside of maybe childbirth or something
Hmm.
like that. Nobody's
There's happy outcomes, but the vast
yeah, yeah.
majority.
You don't want to come see me, kind of a thing. Nobody wants it. So that makes it hard just up front.
Mhm.
But really, the impediments are the fact that um, you need to come see me. I can't tell you what it costs, and you don't pay me.
Mhm.
And so, from a commerce perspective, it's not like anything else, right? It's not retail, it's not hospitality, it's not financial services. You've made a deal with an insurance company and we've made a deal with an insurance company, and it's just this really weird triangulation around how this works. And so I think a lot of times the impediment is um, I don't have a real great way from a commerce perspective to allow you to buy something from me. So the ability to try to connect the dots is one. The other big piece, I think, is the technology component. We run off of a medical record, which was on paper in a folder for a really long time, right? And as we move to electronic health records, electronic medical records, there's still very limited interoperability between that, right? So the hospital's medical record and the one at your doctor's office, they don't necessarily talk. Um, and so again, trying to stitch all of these things together where you, the consumer or patient, can log in somewhere and see what am I due for? How much money do I owe? It's just a very different world. And so a lot of times if you come see us, the industry, not us, Ardent necessarily, but you'll get a bill from the hospital, you get a bill from the doctor, from the surgeon, from the anesthesiologist. They're all independent, and it's just a tough world to try to stitch all of that together. So from a consumerism standpoint, booking an appointment or checking in online, what are you checking in for? Who are you booking with? And some of those types of things just make it difficult.
So, I mean, like I said, nobody really wants to go see their doctor.
Yeah,
Um,
no.
as an entity where, maybe there's some competition, how do you differentiate knowing that you
Hmm.
can't actually, I mean, the
Hmm.
normal way to differentiate is with price.
That's right.
That's hard to do when no one knows any of the pricing.
Yep.
How do you differentiate? How do you encourage people to come in? What?
Yeah. Yeah. So, I mean, on the pricing front, I mean, that's where we have folks in our organization that work with all of the insurance companies, with the payers, right? So so you're making it where somebody that has Blue Cross or somebody that has Humana can actually come get your services. But past that, you're right. It's very hard to, in a lot of cases, it doesn't matter. You come get an MRI, I could bill you $1 million. Really doesn't matter. You're going to pay whatever the contracted rate is. It doesn't matter what the bill says,
Mhm.
So again, very weird scenario. So a lot of it is on the experience side. How do you personalize the outreach, the engagement, make it as if you know who this person is and what they need, and then how do you make it easy for them to then consume services from you? And so that's everything from booking an appointment, scheduling, arriving, all those types of things, but even wayfinding and the experiences that you have as you arrive. Where do you park? How do we do, and so we've implemented some things like if you booked a primary care appointment at one of our organizations, you can check a box to say, hey, let me know if there's an earlier appointment time that comes available. Somebody cancels or whatever it is. And so it's kind of a wait list and backfill functionality. Well, we launched that last year, and folks on average that sign up for that are saving 28 days. Well, that's fairly meaningful.
Mhm.
And again, it varies by specialty, but trying to create ways to reduce the friction. And we talk about it as the consumer department. There are goals to make it easy to access, easy to use, easy to experience. And so it's just how do you cut down those friction points? And I think if you can do that, much like other things you don't want to do in your life, if you can make the experience that much better, that much easier, you can differentiate yourself. Because in a lot of cases, hospitals all do basically the same thing, especially in medium or smaller size communities.
Mhm.
Yeah.
So the tick a box to sign up for a scheduling gap that appears. So this is
Mhm.
it's good innovation, it's customer focused. How do you guys go about trying to identify and capture that information, right? So it seems pretty easy. Oh, well, I'll just let people tick a box and then they can go. You can't do that, of course, unless you got IT, but you also need people out there kind of interacting to find out
Mhm.
maybe with the physician, maybe with the customer that these opportunities exist. How do you bring that in?
Yeah, we've got a couple different ways. So I've got a group kind of on my team around the voice of the customer, right? And so we have some regulatory surveys that we have to do if we want to receive, government payer money. So Medicare, Medicaid payments, you have to do some of these regulatory surveys called HCAPs. So you learn a lot from those surveys, and they're in most cases kind of a likelihood metric. Cleanliness, was the room quiet, doctor on time. So you get some of those types of things. We have other voluntary surveys, especially in the ambulatory or the outpatient space, like in doctors' clinics and things like that, where we can learn a lot. And then we have what we call patient family advisory councils, or PFACs, where we have members of the community spend time, give feedback, almost like focus groups.
Mhm.
And so we do some of those in person, a digital platform. There's several of them that exist in this space that allow you to kind of facilitate that online. People, QR code on their discharge paperwork. They can opt into these groups. They can vote on ideas, and it's a little bit of an ideation even, but give feedback. So there's different ways that we elicit that feedback from the consumer, also from the physician. In a lot of cases, um, especially in certain states, we don't employ the doctors. They're independent community physicians, and they refer to maybe specialists that we employ, or maybe into the hospital for tests or procedures or whatever it may be. And so working with them, we have what they call service lines. So like orthopedics, cardiovascular, et cetera. So we have service line meetings and try to elicit out of them, what are the pain points? Where are you struggling? How can we help? What are you hearing from your patients that we can help try to make better and more efficient? Um, and so those are some of the ways from the clinician standpoint, also from the consumer standpoint, and then we do the same thing with employees. It's a very competitive space. There's not enough nurses, there's not enough doctors, and so you want to retain as many that you can, especially if they're good. So we want to get their feedback and make sure, things like burnout and things that we've seen since COVID, how do we address those and solve for that?
Yeah, so a lot of feedback sessions
Yeah.
essentially.
Yeah.
So all right, flipping back to when you were younger, you
Hmm.
wanted to go into art. So you came into business maybe because somebody was twisting your arm a little bit.
Yeah.
How did you get into healthcare? So where
Yeah.
where was that jump?
That's a good question. So I did. I chose a college based on where they allow me to play basketball. I'm not sure I wouldn't recommend it. That's not the best way to go about it. But in any case, when I got there, um, I grew up in a family that had a family business, and just kind of felt like that was probably my logical path and where my interest was. I've got a little bit of an artistic background, and so after taking finance, accounting, and economics, I learned pretty quickly that I'd veer towards marketing. And to be perfectly honest, it was where my interest was. I liked the ideas, the concepts, and not just the advertising or more art related, but really the research and the data was really the more interesting part to me. Um, Understanding who the customer was, how do we reach them, even some of the behaviors relative to segmentation, and how do we understand who the people are that we're trying to serve. And so got a marketing degree, got an MBA, worked in professional sports for a minute, and then telecom, and through just an interesting kind of course, met an individual down in Florida that had a healthcare consulting company. He said, "Hey, you ought to work in a hospital." I said, "This sounds terrible. I don't know why anybody would do that." But I loved the idea, the concept of it, and had an opportunity to go as the director of marketing to a hospital 20 some odd years ago. And what I will say is, healthcare, you don't have to be a clinician to really understand that everybody there has a calling to do this. It's kind of a mission oriented idea. I've had a lot of chances through the years to go do something else, and it's just not as motivating. And so, understanding, especially, we have 30 hospitals, we're in 9 markets across 6 states, and just seeing the communities that we get to serve is just really, really interesting. And it's just meaningful work. And so it's been a lot of fun.
Cool.
Yeah. Yeah.
So yeah, kind of explored a bunch of stuff
Yeah.
and then came
Yeah.
back to one that had a pretty high call.
Yeah,
Yeah, awesome.
absolutely.
Yeah, any
Absolutely.
advice for yourself when you were 20?
Yeah, honestly, I've thought about this a time or two now that I've got a son about to go to college, and, got kids getting older, and, some of those types of things. And so, um, I would say the biggest thing for me, I remember when I went to a hospital, director of marketing communications, and shortly after, I don't remember exactly how long I'd been there, but I was handed the patient experience kind of initiative, if you will. Hey, you get to be the initiative champion for all of our patient experience work. And at the time, I thought, I don't really understand. This makes no sense. This has nothing to do with what I do. And to be fair, yes, marketing was my job title, but really advertising is what we did, community relations, some PR, things like that. But we didn't really do marketing. It was more just outreach and engagement kind of stuff. Um, so when I was handed this, it was like, well, okay, this is fine, I guess. Maybe one day I want to run a hospital or something. So this is good experience. Who knows? But thinking back now, if I fast forward to where I am today, and I have all of the marketing and communications work, but I also have data and technology, creative services, I have our access work, like our contact centers and things like that. and I have experience. And so now it gets really hard for me to tell you where the line starts and stops between engagement and experience. And so I would say, really, to anybody, look for opportunities, look for ways to say yes, because you don't really ever know 5, 10, 15, 20 years from now what this is going to look like. I mean, the internet barely existed at the time, right? There was no social media. And so it's changed quite a bit since I started. And so there's no way to predict that. So just looking for opportunities. How do you get involved? How do you continue to say yes? I think that's whether I meant to do it or not served me well. So yeah,
Yeah, keep your eyes open, keep an open mind
yeah,
about what you're going to try.
yeah, absolutely.
Because world's too quick to try to silo yourself.
Yeah, and I will say it's probably more so than any other time, the idea of entrepreneurship exists even inside of my job,
Hmm.
right? And so when I first got to Ardent, and I still do, quite a bit of my time is spent with our clinical staff. You say, "Oh, what is that? That makes no sense." Well, as we think about remote monitoring, wearables, the shifting side of care from the hospital into the home, well, all these are consumer-facing initiatives, telehealth, the virtual care pieces. And so now I'm getting to participate in a clinical world as a marketing guy,
Hmm.
right? Again, not something I would have ever thought could have been an option, right? And so now it's just a very different way where our chief medical officer may be asking me, hey, as we think about wearables and we think about sending people into the home, and we think about social determinants of health and some of the more cultural barriers and things like that, how should we think about this and do that? I've never been to medical school, and so, but again, getting to participate in a very different way than I probably could have ever predicted.
Yeah, fascinating. Anything
Yeah,
else you want to touch on, sir?
that's great.
No, you did. You know, this is so enjoyable. Thank you, Mr. Smith, for sitting down
Yeah,
with us
happy to
today.
do it.
Yeah, howdy toddy. Have a good afternoon.
Thanks.